The gentlelady from Connecticut, and as I would want her to know, I am ecstatic about the great leadership of her chairwomanship, as well as all of the cardinals who worked. And I thank my colleagues on the other side of the aisle, many of whom really know that this is a very, very fine response to the needs of the American people. And might I just say, Madam Chair of the Appropriations Committee, just very quickly, I was here for the Hyde Amendment. I was on the Judiciary Committee. And I think my colleagues need to understand that for all of the years of the Hyde Committee, women who were poor, who were Medicaid recipients, many of them might have died in childbirth, might have had other important emergency health issues because they were subjected to decisions that they did not make for themselves. And in that instance, we have discriminated against women just because of their poverty. Again, abortion is that of the woman, her faith, and her family. And I believe this eliminating of the Hyde Amendment is finally saying to all women in America that we respect you and your bodies. I'm very grateful for the support of an amendment that recognizes the crisis of diabetes and the need for research professionals and patients participating in clinical trials. Diversity in medical trials is essential to ensuring that cures, especially vaccines and therapies, work for the greatest number of persons. So my amendment decreases and increases the amount for $10 million to emphasize and get more emphasis to develop that diversity pool in research professionals and patients participating in trials. In addition, I have...
I yield 30 seconds.
I thank the
Gentlewoman is
gentlelady.
recognized.
Diabetes impacts all socioeconomic and ethnic backgrounds, particularly African Americans. I meet many people in my constituency who's had an amputation because they were not able to receive medical care. Finally, I have an amendment that increases and decreases funds, $10 million, with the intent of supporting individuals who might not finish college because of impact by COVID. COVID is now resurging, but the Delta variant is resurging. People are being hospitalized, the unvaccinated. I make a national plea for people to be vaccinated, and as well it is impacting young people. That means that we need to focus on young people getting vaccinated. They're in college. We don't know if they're not vaccinated, how it will impact their education and their future life. So this is to provide for targeting programs to reach out to young people to tell them, one, get vaccinated, but to give them a bridge so that their education will not be interrupted, that they'll never go back again, that they will suffer economically. And I appreciate my amendments being brought to the floor. And I thank the leadership. And as well, I thank you for all of the community projects that will help the impoverished in my district. I yield back.